Hello, Ms. Starch. How are you doing today?
I'm good. Are you doing okay?
Yes. So today we are going to talk about the 4 different types of medication that you are currently on. And my understanding is that you are taking these medications due to your past history with breast cancer. Is this correct?
Yes.
Okay. So what we are going to do is talk about each medication really quickly, and then we're going to go more in depth with each medication and talk about the mechanism of action, the half-life, possible side effects, special considerations, and exercise considerations concerning each medication. Okay?
Okay.
Okay, so the 4 types of medications that you are currently on is baby aspirin, Ibrance, Flazodex, and Zometa. Is this correct?
Yes.
Okay. Baby aspirin and Ibrance, as my understanding, is that they're taken more frequently than the other 2 types of medication. You take baby aspirin every other day at bedtime, and Ibrance, which is a form of chemotherapy, is taken in 100 milligrams a day at bedtime for 21 days, and then you take a week off of this medication. Is this correct?
Yes.
Okay, and then the next type of medication, which its brand name is Flazodex, but its generic name is fulvestrant, is your estrogen blocker that is taken in the form of 2 injections every 28 days. And these injections are given at the left and right buttock at intramuscular junctions. Is this correct?
Yes.
Okay, and then the final medication would be Zometa, which its generic name is zoldronic acid, and this medication is taken every 6 months, and you've been taking this since 2013, and it is administered through an IV drip. Is this correct as well?
That's correct.
Okay, so now we're going to talk about each medication more in depth, and you might hear some terms that you don't have a very good understanding of, so feel free to ask questions as needed, and I'll continue to check in with you to make sure you have a good understanding of what I'm saying, okay?
Okay.
Okay, so the first medication is baby aspirin, and the mechanism of action for baby aspirin is that it inhibits the activity of enzymes involved in the synthesis of mediators that have to do with inflammation and blood clotting. So basically, it brings down your inflammation levels, and it also prevents your platelets from clotting as well. The half-life of baby aspirin is 0.25 hours, which is 15 minutes.
What
Possible.
does half-life mean? What does that mean?
So, a medication's half-life refers to how long it takes for half of the dose to be metabolized and then eliminated from the bloodstream. More simply put, half-life is the time it takes for the medicine to be reduced by half. And this is just a common way that medical professionals communicate as far as medications to have a consensus on just how quickly medications are metabolized. And a lot of times you can also find this on the labels of medications, and it's just a broad form of labeling medications so that everyone can have kind of a general understanding on how quickly they are metabolized. So possible side effects of baby aspirin is gas, bloating, heartburn, stomach pain or ulcers, dizziness and nausea, easy bruising and bleeding, and in extreme cases, it can cause kidney problems. Have you ever experienced any of these side effects?
No, not really.
Okay. Some special considerations that you need to keep in mind when taking baby aspirin is that you should avoid taking it with ibuprofen or other non-steroidal anti-inflammatory drugs. You should also avoid taking baby aspirin if you have an upcoming procedure, asthma, or a concussion. And then finally, some exercise considerations that you need to keep in mind is that when it's taken in the proper dosage, aspirin does not have too much of an effect on exercise restrictions. A lot of people, specifically athletes, might take it pre and post workout to help with inflammation, but you should be aware of when you are taking it, because in some cases taking it before a workout could exacerbate an injury if you experience one. But as long as you're taking the proper dosage, you should be fine. Do you have any more questions about baby aspirin?
No, I don't.
Okay. So the next type of medication that we are going to talk about is Ibrance, which is a form of chemotherapy. And the mechanism of action is that Ibrance inhibits the proliferation of tumor cells and tumor growth. So the half-life of Ibrance is much more than baby aspirin. It's actually 27 hours. And possible side effects that can come from Ibrance is low white blood cell counts, lung problems, low red blood cell and platelet counts, hair thinning or hair loss, loss of appetite, fatigue, and nausea or vomiting. Have you experienced any of these side effects?
I have. I've experienced low white blood cell count and hair thinning.
Okay. So some special considerations that you need to keep in mind when taking Ibrance is that it should be taken once daily at the same time, either at morning or at night. And it sounds like you've already been doing this by taking it every night at bedtime. It also is usually taken in 3 weeks on, 1 week off intervals, and you've been doing that as well. An interesting fact about Ibrance is that it should not be taken with grapefruit. And there are some other medications that it shouldn't be taken with, but they are medications you probably haven't heard of before, such as antifugals or phenytoin or rifamycins. So just be sure that you're keeping in touch with your doctor and constantly communicating with him about the medications that you're on so that he can be aware of whether or not you should be taking those medications with Ibrance. So
I have a question. Why can't I take it with grapefruit? What's wrong with grapefruit?
So grapefruit interferes with proteins in the small intestine and liver that can break down medications. So if you eat an excessive amount of grapefruit or drink too much grapefruit juice, it can lead to higher levels of these medications staying in your blood, which could increase the possible side effects from the medication. So that's why it was recommended to be aware of how much grapefruit you're eating or drinking. And then finally with Ibrance, the exercise considerations that you need to keep in mind is that since you have low white blood cell counts, you need to maintain a sanitary workout environment, because a lot of times working out at a gym, that's a common place for germs to be exchanged between people. So make sure that you're washing your hands, washing the equipment that you use before and after you use it. You also need to be aware of your fatigue levels with Ibrance, and one way that you can do this is to include a warm-up and cool-down, and this will also prevent dizziness and nausea that could be caused by Ibrance. But overall, if you're taking Ibrance as you should and you're taking it consistently at the same time every day, it shouldn't affect your exercise levels too much. Do you have any other questions about Ibrance?
No.
Okay. So the next type of medication that we're going to talk about is Flazodex, which, as I said before, its generic name is fulvestrant. This type of medication is an estrogen receptor antagonist, which works by blocking the action of estrogen on cancer cells. So the half-life for Flazodex is actually 50 days, which is a very long time, which is probably why you don't take it as frequently. Side effects that can be caused by Flazodex are hair loss, headache, bone, muscle, and joint pain, nausea or vomiting, loss of appetite, weakness, coughing, trouble breathing, hot flashes, and in extreme cases, it can cause abnormal liver function. Do you experience any of these side effects?
Just the hair thinning.
Okay. So some special considerations with Flazodex is that you should not receive it if you are pregnant, if you have a liver disease, or a bleeding or clotting disorder. You should also call your doctor if you have any signs of nerve damage, because sometimes in more severe cases it can cause numbness, tingling, weakness, or burning pain. Have you ever experienced any of these?
No.
Okay. And then finally, some things you need to keep in mind when exercising is that you should not exercise if you are experiencing extreme fatigue or anemia, which anemia is just simply low red blood cell count. You also shouldn't be exercising too intensely if you're experiencing a lack of muscle coordination, which is called ataxia. This can also be caused by Fozet-X. And this medication can affect bone density, so you may have to lower the intensity and duration of your workout or just change the type of workout that you're doing depending on how much your bones are affected by the medication. But this is also something that you should target in your exercise as far as maintaining bone density, since this is something that is affected by Fozet-X. Do you have any more questions about this medication?
No, I do not.
Okay, so finally, the fourth medication that you take is Zometa, and the generic name for Zometa is zoldronic acid. The mechanism of action for Zometa is that it inhibits bone reabsorption and stimulates osteoclast apoptosis. And the half-life of Zometa is 167 hours. Possible side effects that could result from taking Zometa is fever, bone pain, nausea, or redness and swelling at the injection site. Have you experienced any of these side effects?
I have not.
Okay. Some special considerations that you need to keep in mind when taking Zometa is that loop diuretics should not be used with it, and patients need to be sure that they are hydrated and that their calcium, magnesium, and phosphate levels are constantly monitored, because this can all be affected by Zometa. Finally, one thing that you need to keep in mind when exercising while you're on Zometa is that hypocalcemia can be caused, which simply means low calcium levels. So exercise should be stopped or monitored if muscle spasm and tingling occurs. Calcium is a really important part of muscle health, so since Zometa affects calcium levels, this is something that you should be aware of whenever you are exercising. Do you have any questions about Zometa?
I do not.
Okay, so one thing that a lot of people don't know about Zometa is osteoclast apoptosis, which simply means cell death of the osteoclasts. And that kind of can sound scary if you don't really know what it means, but it just helps to increase the effectiveness of the medication. It inhibits bone reabsorption further. So that was something that I had read about a lot when researching your medications. So that's just something for you to know as you continue to take that medication. But other than that, thank you for your time, and continue to be in touch with your doctor about any other questions that you have about these medications.
Okay, thank you.